I'm Julie, and I have lupus. Lupus is a systemic disease. It affects all your body systems. It's different in every person, and it varies in every person from severity, from mild to severe. In my case so far, lupus has attacked mainly my skin and my nerves. I've had some other trouble. I have inflammation in my connective tissue in my feet, which makes it difficult to walk sometimes. I've had kidney trouble, but I'm one of the lucky ones. My kidneys have bounced back. I have what's called sun photosensitivity, meaning that the UV from the sun, as soon as I'm exposed to it, within seconds, I break out in a rash. I have hives, itchy rash. My arms, I don't know if you can see here, they're scarred up and down on both sides. My chest, I break out in rashes and lesions, what's called vasculitis, little red dots, which is inflammation in the blood vessels under your skin. And this right here is a scar from a lesion that I've had, so it does leave a mark. I have another one right now on my face, right here under the band-aid, and I might as well show it to you. Ouch. Right there. And it's really nasty looking. These types of lesions, they're pretty deep. They have what's called necrosis, where the skin is and the flesh is coming back, where some of it has died. And so they take 4 to 6 weeks to heal. I get discoid rashes also on my head, and when I do, I lose the hair anywhere where the rash is, and they hurt. So my skin's very sensitive to UV and to sun. Some people with lupus have this, some people not as much. Okay, I get sores in my mouth and nose. On the outsides that look like cold sores, on the insides, on the roof of my mouth, on my nose, the outside, inside. And for me, that's one of the telltale signs that I'm having what I call a mini flare, which sometimes leads into a bigger flare, and that's when I had a kidney trouble. And I have, lupus likes to attack my nerves. I have neuropathy I've had for almost 20 years. They used to think it was from gestational diabetes and type 2 diabetes, but I've always had my sugar under good control, so my A1Cs were always under 6, so they had no idea until I was diagnosed with lupus 2 years ago. So now we know where the neuropathy comes from. In the past couple years, it's worsened. Used to only be in my feet. Now I have it in my hands, arms, and legs. It is, the best way to describe it for me is, feels like a motor that's always running in my feet, always in hands, always doing something. I get freezing pain, I get burning pain, and even though they're severe, they're not as bad as zapping pain. I get lightning-like pain in my hands and my feet, and that go up my legs. And when that happens, it's absolutely debilitating. Nothing helps it. No medications, nothing. And I'm pretty much just laying there waiting for it to go away. It's a zap, zap, zap. Somebody told me they call it Aunt Agatha's traveling pains, which is funny, but it kind of describes it, where it travels up your legs. In the past year, I've also developed cranial neuropathies, which are neuropathies in the base of your brain. And what happens there is I have nerve damage there, and I have a disorder called trigeminal neuralgia. This is a nightmare. Trigeminal neuralgia, also called tic douloureux, is what they say is the most painful condition known to man. And what it is a zapping type pain on one side of your face. For me, it's my left side, and it feels like my jaw muscles get tight, and I have sort of unusual attacks where not only is the zapping and I get a headache, feels like my left side of my forehead is in a vice, my cheek muscle pulls back, my eye twitches uncontrollably, my cheek twitches. My jaw feels as if it's being pulled, and one of the best ways that I could describe it is it feels like somebody's reaching inside my mouth and pulling my teeth out from the inside. During an attack, my muscle control, I lose control of my muscles in my neck and my chin, and what happens is it pulls my face to the left and I'm paralyzed there. I can't move. It's absolutely debilitating. I laid with my head that way, not able to move, with just tears coming out of my eyes. I couldn't, I couldn't talk. I couldn't move my jaw to speak. And this was horrible. I pretty much live in fear of another attack. I've had minor attacks that lasted for, I would say, the whole worst part of it is for about 2 weeks. And then it lays off, and I never know when another one is going to come on or not. I get other cranial neuropathies or distortion of taste and smell, and other than being really annoying, at least those things aren't painful, but that's all part of my lupus. I get inflammation, everywhere, which is the body just reacting to it. I have anemia, so I have fatigue from the anemia. It's chronic. It can't be treated. And I worked as long as I could, and now I work from home at maybe 5 to 10 hours at the most a week. But I'm lucky that I'm able to do that. And really, it's just a matter of some days are good and some days not so much. I have a tendency to get viruses. Not like you would get sick with a runny nose and a cold and a fever and a sneeze. I get viruses in my nerves and muscles, and what happens is I have muscle weakness. So my last virus, I lost the ability to walk. And it was very scary. It happened for 2 to 3 days. I have autonomic neuropathy as well, and what that means is that I have neurogenic bladder, which means I can't feel when my bladder is full. So I have a tendency for urinary tract infections and bladder infections because I can't tell. So I go all the time, and this way I don't have as many problems with it now that I know about it, that they were able to discover that. Having lupus has, it's changed my life. I consider myself one of the lucky ones, though. I haven't had, thank God, problems with my heart or my lungs, and for now I'm managing as best I can. And that's it. Thank you for listening, and I'm just hoping to bring more awareness to lupus by talking about it. Any questions, you feel free to write me. Thanks so much.